Hello YouTube, welcome to Dr. Vibes Learning Point. In this video, we'll study about the acute retention of urine and in details BPH. So what does acute retention of urine mean? It means that there is sudden, painful inability to void the urine voluntarily. All the words are very important. Sudden, painful inability to void the urine voluntarily. This can be of two types. It can be spontaneous and it can be precipitated. The spontaneous, it occurs as a reason of progressive BPH. So patient has benign prostatic hyperplasia. If that progresses, suddenly you see that there is retention of urine. Now precipitated can have certain reasons. Like first, there can be a surgical procedure that has been performed under general anesthesia, regional anesthesia, or there can be UTI or administration of anticholinergics and sympathomimetics. So spontaneous is progressive BPH and elderly means, and precipitated is UTI, anticholinergics, sympathomimetics, and a surgical procedure. Now there is a diagram which I want you all to draw. The first one here is the bladder, and bladder is progressing into urethra, and urethra is surrounded by prostate. Now the second one is a cut section of the prostate in which you have the circle in the white in the center is the urethra, surrounding it is the prostate. You have the two blue colored structures here, that is the transitional zone. The green colored one structure, that is the central zone, it is located centrally in the cut section. The yellow part that you can see is the peripheral zone, and the red part that you can see is the anterior fibromuscular zone. Okay, now the BPH that is common from the central zone, and carcinoma prostate is common from the peripheral zone. How will you remember this? Carcinoma prostate, so P for prostate, P for peripheral zone. Now come to the vascular supply of prostate. Prostate is supplied from the prostatic artery, which is a branch of the inferior vesical artery. The veins is the prostatic plexus, which comes from the Batson plexus. And the lymphatics are the internal iliac lymph nodes. Okay, let's come to the physiology. So you have the hypothalamus that will release LH releasing hormone, that is LHRH. It goes and acts in the pituitary. It will ask the pituitary to release LH. LH, that is luteinizing hormone, acts in the Leydig cells of the testis, and the testis will secrete testosterone. This testosterone will act on the prostate first. Second, with the help of enzyme 5-alpha reductase, it changes into 1,5 dihydrotestosterone. And why is it converting? Because 1,5 dihydrotestosterone also acts on the prostate and is much more effective than testosterone. Rather, it is 5 times more effective than testosterone. And both of them act on the prostate. Now, let's come to the etiopathogenesis. So there is a elderly male, mostly more than 60 years, who usually has BPH. There is not one factor which can cause BPH, there are multiple factors. But primarily it is the endocrine which has the more control over it. So, as I told you that there is an increasing male. What happens with the increasing age? With increasing age, there is decrease of androgen and there is increase of testosterones. So what will happen? This will act on the prostatic stroma and the epithelium. Prostate has a stroma part, prostate has an epithelium part. So it will act there and it will cause the enlargement of the transition zone. Okay? So if the transition zone is enlarging, what will happen? It will cause the compression of the peripheral zone. Just look at the diagram which I have mentioned you now. If the transition zone gets attached, peripherally में जो yellow color का part है वो तो compress होता रहेगा ना. That will cause the compression of the peripheral zone, and a surgical capsule will be formed. So here in this diagram you can see that there is the enlargement of the transition zone. So ultimately the gap of the peripheral zone getting compressed. So ultimately a surgical capsule is getting formed. Now As I told you that there is hyperplasia because prostate का stroma, prostate का epithelium दोनों ही enlarge कर रहा है. So there is hyperplasia. What will happen as a result of this? There will be protein enlargement. बहुत सारा अगर proteins हो गया है तो वो क्या करेगा? That will cause obstruction to the bladder outflow. Right? Prostate में अगर proteins बहुत हो गया है, prostate अगर फूल गया है, prostate के around क्या है? Urethra है. So there will be obstruction to the, क्योंकि urethra छोटा हो जाएगा, तो obstruction to the bladder outflow. Now this can be a mechanical obstruction, this can be a functional obstruction. Now all these processes can lead to two types of obstruction. Mechanical obstruction, that is due to the proteins which have been formed and obstructing the bladder neck. And then there is functional obstruction, that is due to the smooth muscle hyperplasia. If there is smooth muscle hyperplasia, that will cause the increase in the sympathetic tone and increase in the tone of the prostatic urethra. Both of them will lead to secondary bladder response. So overall, what bladder changes are occurring? There is detrusor muscle hypertrophy and collagen deposition. This will lead to overreactive bladder and voiding symptoms. Now let's come to the symptoms. So the symptoms can also be two types, obstructive and irritative. Obstructive symptoms you can remember by the mnemonic HP SIR. H, that is hesitancy, P, that is post-void dribbling, S, that is straining, I, that is incomplete voiding, and R, that is reduced stream. And irritative symptoms you can remember by the mnemonic FUN. F is that is increased frequency, U that is increased urgency, and N that is nocturia. Now let's see what are the signs that a patient will, that you have to see as a doctor. First, you can also remember this by the mnemonic SITS. C for consistency, I for induration, T for tenderness, and S for size. After clinical diagnosis has been made, we proceed to lab findings. Obviously, it is related to urine analysis because urine ka hi problem hai. So, the findings that you will get, that is hematuria, increased WBCs. You will do a renal function test, that is urea creatinine, in case of obstructive uropathy especially. You do a PSA, which will be increased. And in imaging, you have USG of the KUBP region, that is kidney, urethra, bladder, and prostate. Now, why do you do this? Because it tells you about the prostatic volume and it also tells you about the post-voidal volume. There can be some additional tests like cystoscopy and uroflowmetry. Now, what are the DDs of BPH? Obviously, prostatic cancer can be one. Second, you can have UTIs. Third is any bladder calculus. Fourth, there can be carcinoma of bladder. Okay. Fifth, bladder neck contracture. And obviously, 6 is BPH. So, cancer involving prostate, bladder, calculus, UTI, and BPH. Now, how do you manage a patient of BPH? You have to divide this into two categories. आप mild symptoms देके present करे हो या फिर moderate symptoms या फिर severe symptoms. If the patient is mild, just wait and watch. If there is a moderate symptom, then you can go for medical therapy first, and then if it fails, then surgical therapy. In medical therapy, you have alpha-1 blocker, because that will block the ureteric sphincter, that is tamsulosin, and you have 5-alpha reductase inhibitor like phenosteride. And in surgical management, when do you do the surgical management? That is important. One, when the medical management fails. Second, when you have recurrent UTIs, when there is a bladder stone, when there is recurrent gross hematuria, when there is a renal insufficiency, and there has been several attempts of catheter removal. What are the surgical options? There are two surgical options. One is the endourological interventions, and the second one is open surgical procedures. In endourological interventions, you have TURP, that is transurethral resection of prostate. You have TUIP tube, that is transurethral incision of prostate. You have laser guided HOLEP, and HOLEP stands for holmium laser enucleation of prostate. And you have transurethral microwave therapy. And then there is open surgical procedures. Now this is done when the gland is so big that it is crossed 100 grams and there is concomitant bladder diverticulum. So this is all about BPH. We have studied what is acute retention of urine. We have studied a diagram of prostate. What is the pathophysiology, causative or factors. We've also studied the clinical features, signs and symptoms, the investigations, and how will you manage a case of BPH. If you find the video useful, please subscribe.